to Ask Dr. Mingle, the Q&A series from Mingle Health, where we take your questions about quality programs and the transition to value-based care. My name is Hadley Taylor, a MIPS quality program consultant. I'll be hosting this episode along with Dr. Dan Mingle, founder and executive chairman of Mingle Health. Good morning, Dr. Mingle.
Good morning, Hadley, and good day to all of you tuning in. It's great to see you again. I'm Dr. Dan Mingle. I'm here to answer your questions to the best of my ability.
Before we start, I want to invite our listeners to send in your questions. You can leave the questions in a comment on LinkedIn or YouTube, or you can email them directly to us at hello@minglehealth.com. Okay, our first question today is from Mary Ellen. Mary Ellen asks, will the APP persist after web interface retires?
Great question, Mary Ellen, and the answer is yes. APP is the new scoring standard for the Medicare Shared Savings Program. It refers to all the elements of quality performance measurement and scoring. It includes the CAHPS survey measure. It includes 2 administrative claims measures and includes a set of submittable measures. In this intermediate phase, that is between the announcement of the program and the actual sunset of the web interface, you can satisfy the submittable measures with the 10 measures of the web interface, or you can use ECQMs or MIPS CQMs to submit 3 measures that will permanently remain with the APP. So after the web interface sunsets, starting the 2025 performance year, the APP lives on with only 2 options for the submittable measures, the ECQMs or MIPS CQMs. Thanks, Mary Ellen. I hope that answers the question for you.
Wonderful. She's also asking, Mary Ellen is the sunsetting of web interface subject to payment year 2023 final rule, or has that ship already sailed?
Well, interesting question, Mary Ellen, and it's a bit hard to answer. In a way, that ship has already sailed. Medicare is submitted. It's already set as a rule. In the 2022 final rule set the sunset of the web interface to follow the 2024 performance year submissions. So no other rulemaking needs to happen for it to happen on schedule. But we all know that things do change. Pandemics and other disasters happen. New legislation gets passed. Intentions and rule changed. And nobody changes more often than Medicare, it seems. The proposed rule for 2023 doesn't alter the expectations. It's still expected to lapse after the 2024 performance year. And without being in the proposed rule for 2023, it's unlikely to be in the final rule, but I didn't say impossible, just unlikely. Still, the 2024 and 2025 rulemaking cycles are ahead of us, and Medicare could still change its mind in that period of time. But every day that passes, it gets more deeply enmeshed in all the other rules and preparations and plans. It gets harder to change. So I think it's a slim chance that it changes at this point. There's a bigger chance that it could be postponed, but pretty much a minuscule chance of cancellation. Hope that answers the question, Mary Ellen. I wish we could be more certain, but we're as certain as Medicare allows us to be.
Our next question is from Karen. She asks, for an APM, what are the requirements for promoting interoperability and improvement activities?
Great question, Karen. And that depends a little bit, or maybe I should say that depends a great deal. All APMs must have 75 of their participants on certified EHR, which obviously means that 25% can be on a non-certified EHR or could still be on paper and still pass as an APM. I wouldn't expect that rule to continue indefinitely, but it's the case now. As a qualified participant, a QP, in an advanced APM, MIPS doesn't apply. So you don't need promoting interoperability or improvement activities. So for the EHR measure, you just need to be using a certified EHR to satisfy the requirements of the advanced APM. If you're in a MIPS APM or you're not a qualified participant, in an advanced APM, so you don't hit the threshold number of patients um, that qualifies you as a qualified participant, then you're subject to the MIPS rules, and they're the same as everyone else's. You don't have to have a certified EHR, and you don't have to have all the elements live on that, but you'd be sacrificing all the potential performance points uh, for promoting interoperability if you don't have an EHR. Now, regarding improvement activities, just for participating in an alternative payment model, CMS grants half of the improvement activity requirements. They say that participation accounts as half of your total improvement activity requirements. In the process of approving APMs, CMS recognizes other built in improvement activities and can or will grant additional credits. At this time, all APMs earn full improvement activity credit for all participants. So if you are a MIPS participant in a MIPS APM, or you didn't achieve qualified participant status in an advanced APM, you are going to get your full score for the improvement activities. So that's thanks, Karen, for the great question. I hope that answers it for you.
Thank you. Our final question today is from Chandra. She's asking, what is your recommendation to improve our APP quality scores?
Great question, Chandra. And I think it's particularly important now that we're in that changeover from the web interface to the the full APP. So, the one thing I'd suggest you do is switch as soon as you can from web interface to MIPS CQMs. And in a previous week, I answered the question of why MIPS CQMs. And I still remind you that I think that's your best option, gives you the most freedom and the potentially the highest scores. It's not too late to engage your registry right now to submit MIPS CQMs to satisfy the APP for 2022. In fact, at Mingle Health, we will be accepting clients right through the 1st of January, or maybe even longer. Now, you might choose to do a simultaneous web interface submission with a MIPS CQM submission, or an eCQM if you choose to go that way. But I would put that investment of time, money, and effort to a different use. And let me explain. By engaging now, you can do a preliminary run of your 2022 data on the first 3 quarters of 2022. Then I suggest you audit your results. The registry you engage should be able to give you a list of specific patients in each denominator with their met, not met, or excluded statuses. I'd suggest you audit about 30 of those patients as a minimum, as a preliminary check of the data accuracy. This will be the first of many steps to steadily improve the accuracy of your measurement. In fact, I'd suggest that improving the accuracy of your measurement is now a continuous, lifelong improvement process. In the final processing of the entire year of data, I suggest you take a list of all of your denominator patients that fail each measure and manually check the chart. It's appropriate for your registry to add your manually extracted data to the submission to improve your scores. Now, an eCQM can only take the properly documented electronic data that's in the submission, but it's entirely appropriate to do a manual abstraction of your charts and correct any missing data in your final submission, so you can get the best score possible. So drawing from all patients and all payers, there's a lot of patients eligible to each measure, but you'll only have to do 3 measures, and you'll only need to abstract the failed patients, and all it can do then is improve your score. As you audit, try to determine the reasons that performance met data was not detected in the electronic data set, so you can go back and correct your templates that aren't capturing the data correctly, or provide supplemental training for your users so that they know where to record the data, that it's easily accessible. You'll find that your scores depend on clinical performance, of course, but it also depends on the proper documentation workflows and effective data exchange. So the nature of the extraction queries and the logic that grades the electronic data. So these three factors you'll be upgrading every year for an improvement in your scores. So start now. Do your first couple of rounds of improvement while you enjoy a relaxed quality standard for those using the CQMs before the web interface finally sunsets. Don't waste till the last minute. So thanks, Chandra. Great question, and good luck with your changeover.
Excellent advice. Thank you. Mary Ellen, Karen, and Chandra, thank you too for your great questions. If you have a question for Dr. Mingle, please leave it in the comments section on LinkedIn or YouTube. And of course, you can send us an email at hello@minglehealth.com. Dr. Mingle, as always, thank you for sharing your insights with us today. We always appreciate it.
Thank you, Hadley, and thanks for all the great questions. I want to be helpful. I want this to be useful to you. Don't hesitate to correct or supplement my answers. Share your experience, ask your questions. We can be smarter together.